it is important to know that, and also to know who you will call if the child's ill. If the child suddenly has a seizure or quits breathing or turns blue, then we hope the child care provider will know what to do in those set of circumstances, rendering immediate first aid and calling 911. On the other hand, if the child is ill, is vomiting, is sick, is terribly fretful or fussy, then the child care provider needs to get hold of the parent so that child can have medical care. And indeed, it may be an illness certainly other than shaken babies, because babies, all these symptoms are caused more commonly by things other than shaken baby, thank goodness.
Doctor, child care providers do very rewarding work, but it can also be frustrating sometimes. What do you say to a child care provider that becomes so frustrated they want to act out their frustration with the baby?
Well, certainly that can happen, and babies can cry, and babies can be irritable, and they poop, and they throw up, and they do things sometimes more often than it can get to anybody. And the most important thing is to kind of, if you can recognize it yourself that, gee, that baby's really irritating me, take a break, walk out of the room. Even if the baby's still crying, crying won't hurt the baby. Take a deep breath, count to 10, whatever you like to do, you can leave the situation. Then you could come back and perhaps just walk with the baby, walk outside, do something different, just kind of refocus. I think the most important thing is to recognize that the baby's getting to you, and give yourself a break in that situation. If you can, or in an environment where another relative or caretaker or someone else in the home can watch after the baby, why, that's also a reasonable thing to do. But babies can get on people's nerves, and that can happen with anyone. The most important thing is simply to recognize it. But whatever you do, don't shake the baby.
Are there any other resources available for a child care provider that wants to learn more about this?
Oh, yes, there are. Certainly, you can contact your local child welfare agencies. Additionally, your local child care licensing agencies will have information about this. Many states have available emergency medical services for children programs available, or resource center, which also has information that can be shared.
Dr. Stemke, thank you so much for visiting with us about this important topic, and the staff here at Children's Hospital ER. Thanks so much.
Thank you, David.
While shaken baby syndrome is one form of child abuse, there are many others. Chances are, if you spend any length of time in the child care profession, you'll see signs of abuse or neglect in your center at some point. It's your responsibility to watch for the signs of abuse and know what to do when you see them. It's widespread. In the year 2002, there were 62,795 cases of child abuse and neglect investigated. Of those, 13,903 were confirmed. 82% of these confirmed cases were due to neglect. Younger children are the most vulnerable and the most likely to be seriously harmed. You may be the only voice a child has while living in an abusive situation. You have a legal responsibility to report suspected abuse and neglect. Some time ago, we had Norma Eves, who's a child welfare investigator for Oklahoma's Department of Human Services, come to our studio to present an overview of child abuse and neglect. She showed us some examples of injuries caused by child abuse compared to injuries caused by everyday accidents. As Norma will tell you, these children in the studio were not abused. Makeup was used to illustrate the injuries.
Today, we have a makeup artist assisting us by illustrating injuries on children. The location of these injuries can help identify possible accidental and abuse-related injuries. First of all, let's discuss the locations of typical accidental injuries on children. These areas include forehead, shins, forearms, and thighs. Now let's take a look at a child. Forehead, forearms, and shins. When you think about accidental injuries, you must take into consideration the age and mobility of the child. The areas of typical abuse-related injuries include eyes, cheeks, ears, areas just above the knees, genitals, middle of the back, buttocks, upper thighs, calves, and abdomen. Again, let's look at a child. Cheeks, thighs, abdomen, and stomach area. It is more difficult to bruise an area of the body where there are large masses of soft tissue. Bruises in these areas are more likely to be abuse-related. In addition to the location of the injury, the shape of the injury can be a clue to what was used to inflict the injury, thus identifying abuse-related injuries. For example, if a child has been struck with force with an extension cord, belt, board, hand, or fingers, a distinct mark or impression will be left. Here are examples of real child abuse situations. Remember, the age and development of the child is very important in assessing whether the injury is accidental or abuse-related. For example, if a 3-month-old child comes into your care with bruises on his face and mouth, it is highly unlikely these are accidental injuries. Let's talk about behaviors and characteristics of children which might indicate abuse or neglect. Extremely fearful behavior. For example, if a child ducks when you move your hands around them, they may be fearful of being harmed. Extremely aggressive, demanding, or rageful behavior. Some abused children display these behaviors as they are starved for attention and desperately seeking it. They also may be imitating the behavior of their parents. Overly compliant or passive behavior. These children may allow other children to take things away from them or go along with whatever is suggested. This may be a result of trying to avoid a violent assault. Extremely dependent behavior. These children may cling to staff and have difficulty separating from them. Keep in mind the age and development of the children to determine normal dependent behavior. Role reversal behavior. Watch for children who assume the role of parent of the other children. They may also comfort and nurture the other children. Extreme lags in development. These may be the result of emotional deprivation or nutritional neglect. Indiscriminately friendly behavior. Many abused children are so hungry for affection they are inappropriately friendly with strangers and playmates. Multiple explanation of injuries. If a child offers more than one explanation of what did or didn't happen to cause the injury, this could be a clue that the injury is abuse-related. It is important to note that behavior and characteristics alone are not necessarily an indicator of abuse or neglect in a child. You must look at the whole picture. What are reporting requirements in Oklahoma? Healthcare professionals, teachers, and anyone who has reason to believe that a child has been abused is required to report the matter